Hey guys, so today I'm going to be talking about the pain management drugs um, and going through those. This is kind of the lecture that I would be doing if I were there. I am making this before I'm on maternity leave, but this is what you'll be watching while I'm on maternity leave. And then the sub will be going through the list of drugs and like after you fill it out, she'll be going over it with you guys. So yeah, let me start by presenting my screen because I don't want this to be super long. Okay, so hopefully you can see my screen, and I'm going to just present this PowerPoint. Okay, so pain management, what is this? So pain, let's talk about that first, is the most common reason for patients seeking medical care. Pain has sensory and emotional components and is often classified as acute or chronic. And depending on what it is what is depends on what they should take for it as far as the medication. So acute versus chronic. So acute pain, you've probably heard this before, is fast onset pain. It's frequently associated with anxiety and hyperactivity of the sympathetic nervous system. Things like tachycardia, so increased heart rate, increased respiratory rate, increased blood pressure, diaphoresis, and dilated pupils can happen when you have acute pain. Sometimes during an acute situation, you won't even feel the pain at first, and it'll come later because your pain receptors don't even have time to feel it. Like if someone were to, get their leg cut off in an instant in an accident or something. Um, and then chronic pain does not involve the sympathetic hyperactivity or the sympathetic nervous system. It's a slow onset and it's usually constant pain. Can be associated with vegetative signs like fatigue, loss of libido, loss of appetite, difficulty focusing, and depressed mood. So all of those things can be signs of chronic pain, like things that just like you do because you don't feel good. A person doesn't feel good, and that's why those are things that can happen because of that. So then you have things like preventative pain relief. This is stuff like anesthesia, examples, epidurals, spinal blocks, etc. So preventing you from feeling pain, either acute or chronic. And that could be because you're going into, a situation where you're going to be in pain, whether that's a surgery or having a baby. That's why you would maybe have an epidural. Um, Things like that, they do have preventative pain relief for. And then people vary considerably in tolerance to pain. So that's something really interesting that they've done a lot of research on is why pain feels differently to different people, because some people feel pain really intensely and other people don't. So it does vary. Not everybody feels pain the same way. Okay, so dosage forms are usually oral capsules, caplets, tablets. That's the most common. Then you've got injections or IV, patches, and inhalants. So all of those can be dosage forms for pain medication. Um, so we're going to go through some classifications of pain medication. So the first is NSAIDs. These are non-steroidal anti-inflammatory drugs. Some of them are prescribed and some of them are not. Some of them are OTC or over the counter. So NSAIDs work by reducing inflammation in the body and thereby relieving pain. The biggest risk and side effect, and this is always a question on the test, the certification test, is what's the biggest side effect? What's the biggest risk? And it's actually gastric ulcers and GI bleeding due to chronic use of NSAIDs. And this is something like if you were using them every single day, taking them every single day for pain, it can really do a number on your stomach, your intestines, the lining of your stomach. It can eat away at your stomach. So, the second biggest side effect is it has a blood thinning effect. So you have to be careful with people that come in, to the pharmacy who are getting something like warfarin, which is a blood thinner. But what if they're taking ibuprofen for pain? A lot of times people don't realize that that actually can be really detrimental to their health. Like if they were to get into an accident or something where they're bleeding, they could potentially not stop bleeding because they don't have enough clotting factor in their body because they're taking so many blood thinners. But people don't realize that NSAIDs have a blood thinning effect. So that's something that you need to realize and know, is that those blood thinners can have contraindications with NSAIDs. All NSAIDs must have patient package inserts, or PPIs, with warnings about the risk of GI bleeding. That's one big thing. There's only a few categories of drugs that require patient package inserts, but this is one of them because they're so readily available on the market. And so people take them constantly, and yet nobody knows until they're in that situation that it could be causing ulcers in their stomach and GI bleeding, and people can, bleed out from that. So that's really risky. And then examples would be ibuprofen, such as Advil or Motrin. Ibuprofen is the generic, and Advil and Motrin are brand names of ibuprofen, and they are over the counter. Naproxen is also over the counter. Its brand name is Aleve. And then I put an RX, or a prescription only NSAID on here. Celecoxib or Celebrex. This is an NSAID that's a really common one. That it's a type of NSAID. There's a subclass for it called a COX-2 inhibitor. And that will be what you put on your list, your drugs list, is that celecoxib. It is an NSAID, but they want you to know that its subclass is a COX-2 inhibitor. That's COX, and then the Roman numeral 2 inhibitor. That's kind of how it works. These are considered analgesics, which take away pain. They're considered antipyretics, which take away fever, and anti-inflammatories, which take away inflammation. So that's another important thing that you need to know. Sorry, you guys, I keep yawning. Oh my gosh, I need some coffee. Okay, maybe because I'm talking so fast, I'm not like getting enough oxygen to my brain. I don't know. Okay, next is opioids. So we've talked a lot about this because opioids are scheduled drugs. They are scheduled and they are regulated by the DEA, the Drug Enforcement Agency or Administration. So they are highly addictive, pain-relieving narcotic drugs. Some examples would be morphine or hydromorphine, Vicodin, and OxyContin. And all of those are Schedule 2s. Also remember, this is just another test question for you to remember, is that Schedule 2 drugs cannot have refills. They have to have a new prescription every single time. Just a bonus question for you there. So how do opioids work? Well, they work on the brain's pain receptors to block pain. This doesn't take away inflammation, so you got to remember that. It just works on the brain. Some risks of opioids, obviously addiction or physical dependence. So literally people, when they stop, if they've taken it for a little while, 2, 3, 4 weeks, regularly, they will start having withdrawals, even like when they don't take it. So it may not even, like, part of the addiction is the fact that they'll start feeling sick or like literally having symptoms, like flu-like symptoms if they stop taking it, which makes it difficult to get off, obviously. And that's why they're so, serious about tapering off and not staying on them for very long if you need them, trying to go with non-opioids for pain after surgeries and things like that, because people get addicted so easily. Okay, and then overdose leading to death. That's a big opioid risk, especially when people need more and more and more and start abusing opioids. Common side effects: constipation, urinary retention, and nausea and vomiting. Most have auxiliary labels encouraging patients to take with food, and also warnings about being addictive. I think people know that, but they need to put that on there as a risk. Okay, so then pain reliever blockers, analgesics that are non-narcotic. So remember, analgesic means to take away pain. So technically, opioids are an analgesic because they take away pain. So you could put that they're a narcotic analgesic drug. So these are analgesics that are not opioids, so non-narcotic. They're used in mild acute pain. They can be they will be an analgesic and they can be an antipyretic. So, for example, Tylenol or acetaminophen. But they are not anti-inflammatories, and that's one big thing that they'll ask you on the certification test is the differences between pain medications that are anti-inflammatories and the ones that are not. Acetaminophen is not an anti-inflammatory. Acetaminophen is not an anti-inflammatory. I say this every year, you guys. And I remind my students every year about this, that it is not an anti-inflammatory. And then like half the class will still call it an anti-inflammatory. So just remember this. You got to put a mental note because this is very important, is that it's not an anti-inflammatory. It's an analgesic, so it takes away pain. And it's an antipyretic, so it takes away fever. But it's not an anti-inflammatory. What it does is it blocks neurotransmitters from sending pain signals to the brain. So similar to opioids, right? And then side effects to know, chronic use can cause liver damage. That's the biggest issue. So you need to remember that as well. I think that was another question on the test that my students said they saw was that was about acetaminophen, what like is a big risk or side effect, and that was liver damage. Because they'll try to trip you up and give you the option of like gastric or GI bleeding. But remember, that's NSAIDs. But you have to remember that with acetaminophen or Tylenol, the biggest thing to worry about is with chronic use is liver damage. And then last but not least, this does not thin the blood. So if someone's taking warfarin or Coumadin, aspirin, other, like their doctor has prescribed them some blood thinners to take, the doctor will probably, if they need a pain medication, go with something like acetaminophen because it doesn't work with the blood. It doesn't thin the blood. So that's a good thing. Interestingly enough, also, this is the only pain medication really that is approved for pregnant women. Pregnant women are not allowed to take anti-inflammatories, so you have to take a something like Tylenol. Okay, and then I always say this wrong. Salicylate. I can never say this. So they're most commonly used. Aspirin is probably the one you know the most. This is actually, I forgot to put this in here, but they are a subclass of NSAIDs. So sometimes you'll see people say that aspirin is an NSAID because it is. It does take away inflammation. And so it technically is, but this is actually a subclass of an NSAID. And it does have anti-inflammatory, antipyretic, and analgesic properties, just like the NSAIDs. So that's why. But it's just I think for the test, they want you to know aspirin is both an NSAID and salicylate. A salicylate. I would have to look this up on Google and have Google tell me. I do that pretty much every year because I don't say it very often. So it relieves moderate pain by blocking prostaglandins. You really don't need to know like the mechanism behind it. You can read about it here if you want. The side effect is decreased clotting. Aspirin is a major blood thinner, so that's one important thing to note. And then we've got anesthetics. So anesthetics are they work by numbing specific areas of the body. I noticed that menthol actually was one on the top 200 drugs list. I'd never seen that before, but menthol actually works in a lot of different ways. You can put it topically, like on like an icy hot, and it works to numb like the top of the muscles, like if you put it on like painful muscles and stuff. And then, but it also is in stuff like cough drops, so it helps you to not cough, like it helps the coughing reflex. So that's one of them you might want to remember. and it's considered an anesthetic, like a local anesthetic, actually. So lidocaine injections work for targeted treatments like tooth repair, skin biopsies, nerve blocks. They put that in a nerve block to stop pain, like an epidural or something like that. And then lidocaine menthol rubs, that I think they have them together. They work really well, like icy hot to numb pain topically. Um, and then general anesthesia works through the patient losing awareness, yet his or her vital physiologic functions, such as breathing and maintenance of blood pressure, continue to function. So that's a major development for the human race, is being able to have general anesthesia, because 100 years ago, maybe I don't even think we had general anesthesia, not anything that worked really well. So that's how you're able to have surgeries and get through them and not have pain. And then there are adverse reactions. Local anesthesia, if nerves in the body are hit, and can cause paralysis. I saw that a lot with something called Bell's palsy, in the dental office, when people would have tooth repair, or especially when they'd have like third molars removed. Sometimes it would hit a nerve, and it would take months to come back where they would feel that part of their mouth again. I had a student once a couple years ago who actually had it, and I don't know if he ever regained that feeling in his face. And so it can range from really mild to like severe, but I think the severe, times that it happens is pretty uncommon, but it can happen. And then general must be closely monitored, because it can result in death. That's why anesthesiologists and nurse anesthetists are in there doing that, so that that is the main thing that they're focused on when you're having surgery. Okay, guys, so that is the end of the pain management drugs. I'm going to show you the drugs list here. So if you need it after Miss Walsh goes over it, you can look at it again, or say you missed class or something. I'm not really sure, because I'm making this after like during the COVID situation. So I don't know how class is going to look next semester, but I'm not going to go over all this, because it would just be extremely long. Uh, It'd be an extremely long video, but I did put on here drug schedules so that you can see. So this is the start, and then I'll go down slowly. And if you need to like stop it at any time and write yours in, you can. So these are all the answers to the pain management drugs. I think that's it. Yeah. So this is what they're going to want you to know. And yeah, you're going to need to know most of these things. I tried to keep it pretty simple. Because most of them are pain, different kinds of pain, but I just put basic pain in here, unless it was specific, like muscle spasm. So yeah, that is that. And I hope you found this interesting, you guys. I will see you later. Bye. Oh, wait, I'm still presenting. Stop presenting. Okay, bye, guys.